Hello and welcome to the Botanical Biohacking Podcast. I'm your host, Dr. Andrew Miles. Today, I am very excited. There is some research that's been very promising. I've had my eyes on it. But could it be possible that scientists have found not only a way to measure qi in the human body, but also manipulate it? Could it be that they've found the very frequencies associated with gasotransmitters? Based on the high resolution, high penetration, and safety of terahertz waves, it's received critical attention from the biomedical field because it's non-invasive and it can illuminate various tissues in the body. It's being used for security. It's being used for diagnostics, especially with tumors or areas where there's water. Now, where this really shines is when you're looking at gas and fluid physiology. In recent years, this has made rapid development, and it's being increasingly used in biomedicine. Terahertz imaging uses approximately 0.3 terahertz to approximately 10 terahertz in the electromagnetic spectrum. So this is between microwaves and infrared. Terahertz radiation is invisible, yet compared to something like X-ray is incredibly safe, non-destructive, and non-invasive. Terahertz tech is helping to illuminate Chinese medicine diagnosis, syndrome, objectification, acupuncture points, and even helping to identify meridians. What is exciting is this appears to not only be useful for diagnosis, but can play a role for treatment as well. Terahertz radiation has been shown to affect the nervous system, including the structures of nerve cell membranes, gene expressions, and cytokine levels. It's been used under various neurological conditions to either ameliorate disease symptoms or rescue disease pathologies, in the same way that physical therapy does. For example, Brukov et al. Treated patients with acute ischemic stroke using infrared radiation modulated by terahertz frequencies. In this case, he used between 0.2 to 0.8. And these were used to stimulate the Baihui acupuncture point on the top of the head. And this is one of the most critical areas for regulating neurovascular activity, according to Wang et al. 2014. Patients in the terahertz group regained consciousness and resolved neurological symptoms faster than those in the control group. What's interesting is that the tissue temperature did not rise more than 0.1 degrees Celsius during the entire irradiation process, suggesting that there's a non-thermal effect of terahertz therapy, which serves to improve oxygen delivery to the brain, increases blood oxygen volume, and promotes neuronal rejuvenation. Now wait, aren't I always talking about gasotransmitters with relation to qi? Did I suddenly flip and change my mind? Well, here's the thing. I never said that gas was every aspect of qi, only that it literally means qi and is the meeting point between all other phenomena. In vivo, nitric oxides can be resonant with terahertz waves generated by a nitric oxide laser at the range of 150.176 to 150.667 gigahertz. Nitric oxide can regulate physiological, pathological, and biochemical processes. Terahertz radiation can affect the central nervous system and behavioral performance of animals by way of nitric oxide. So this could either excite or depress animal activity depending on the nitric oxide frequency range. The behavior range from normal exploratory behavior to anxiety and insomnia. All of this being controlled through these frequencies. In addition, In cases of acute ischemic stroke, there was noticeable asymmetry in key acupuncture points. Bai Hui, do 20, Guan Yuan, CV4, Da Cui, do 14, Da Bao, spleen 21, and He Gu, large intestine 4, as well as Tai Chong, liver 3. And these were all responsive to infrared terahertz radiation, which was carried out prior to stabilization of temperature indicators within the normal range during the clinical processes. So it was normalizing heat in the body. It was regulating the flow of nitric oxide, which is going to carry through vasodilation. It's going to carry blood to those areas. With stroke, that's going to be out of whack, and they were able to restore this by using the terahertz therapy. It goes even deeper. In the field of herb quality identification, terahertz imaging is being used to help determine authentic herbs from counterfeit. And this is important because in the case of cordyceps, which can sell for hundreds of thousands per kilo, it is essential to know what is quality and what is not. And this is opening new doors into quality identification. And this is an area we are extremely excited about at Botanical Biohacking as we sustainably source the best well-crafted herbs on the planet, so we are happy to flex the differences. Tongue diagnosis, I've spoken about it a lot, I've written about it a lot. Tongue diagnosis is an important method for identification of Chinese medicine syndromes. So this is not symptoms, this is syndromes. This is the way that the body is shifting in terms of its microbiomes, in terms of its temperature, moisture, and pressure. This is how the climates of the body are changing within the body. And the tongue, because it speaks so many signaling systems, every signaling system we've had through our evolutionary history is contained within our tongue and is contained without the body. And these signaling systems speak to each other. And by looking at the tongue, you can get a lot of information about the rest of the body. The tongue body and tongue coating especially contains significant information regarding the physiological and pathological conditions of the human body. And the different areas of the tongue reflect the health of different organ systems. Using reflection mode, terahertz, TDs, imaging techniques can be applied. So basically they shine a little detector over various areas of the tongue in the near infrared field. And what they found is that they can beam onto various areas of the tongue. So maybe the upper left quadrant, they can just beam onto this area, have the patient close their mouth. The data is coming up so they know exactly what's going on with that area of the tongue. Then they can move on to another area. But it's more accurate than visual inspection because you can look at a tongue and perhaps it is a red tongue and the coating is thick, but it's clear, so you can't really tell how thick that is. But with this technology, you can tell absolutely how thick it is. So it's opening potential for objective tongue diagnosis. And particularly with identifying biofilms in the body, dampness and biofilms, this can be very difficult to detect with an MRI, but very easy to detect with terahertz. The absorption of terahertz waves by the polymicrobial biofilm of the tongue coating is higher compared to a dehydrated tongue coating due to its higher water content. And this is the way practitioners can get more of this accurate information. This is offering us new insights into areas never written about before in Chinese medicine classics. Now, here's something that your textbook never told you if you were studying Chinese medicine. Liu et Alia conducted a study using an HR2 infrared slow scanning thermal imaging system and identified features and patterns of changes that were specific to differentiated infrared tongue images of patients with different types of Chinese medicine syndromes. And he was able to determine that patients with yin deficiency demonstrated higher temperature at the tip of the tongue compared to normal people or patients with other types of syndromes. These changes in temperature are also being tested on the body as a whole to get a general sense of metabolic health. In fact, they may even be able to tell whether someone's general metabolism is low. In terms of the whole body, Liu et al. Found that a healthy group with normal constitution demonstrated higher temperatures at 8 specific locations, including the index, middle, and ring fingers, anterior femoral and calf areas, knee, posterior femoral, and calf areas. So when people have yang deficiency, they tend to feel cold. Indeed, they were finding that there are specific areas of the body that were cold in conjunction with traditional diagnosis. And using the terahertz, they were able to also identify this. This has also been done using facial temperature gauges to determine whether people have yang deficiency. So this is a way to get more objective data than simply asking somebody, do you feel cold? And then writing down, did the patient feel cold, but then they weren't cold at the touch, or after touching their arm for a moment, it became warmer. These are very subjective. Even if useful, they're very subjective. And this technology promises to offer more objective testing. The research also continues to expand into neurology, the brain, and the influence of acupuncture related to these therapies on the nervous system. So what do you think? Is terahertz imaging something that you would like to see included in Chinese medicine diagnosis? Is this something that you think is just a gimmick? Let me know what you think. Email me at andrew@botanicalbiohacking.com. Also, if you are a practitioner or if you go to see a practitioner of Chinese medicine, check out botanicalbiohacking.com. I have a practitioner sign up and emails that go out with cutting-edge research, information on pharmacology of herbs, and other cultural aspects that just fit better in an email. I am off of social media right now, so I am putting all updates that I find that I think are cool, that are relevant, that are cutting edge, that are maybe too short to merit a podcast episode. I'm putting that all in the email list. So it's the kind of information I personally find valuable, and I hope you enjoy it as well. Thank you so much for listening to the Botanical Biohacking Podcast. I realize this topic is maybe a little nerdy, but I'm very excited about it because this is something that I really want to see this dream fulfilled, where Chinese medicine and Western medicine are both dead in terms of there being any separation between the two. I think it's nonsense that we have this separation because realistically, the traditional ideas of gardening the body are not at odds at all with biology and shouldn't be at odds at all with biomedicine. All of this can be one medicine, and I believe it will be. And by utilizing these kind of technologies, even by going and seeing a Chinese medicine doctor, you're helping to make this bridge, to make this dream a reality, step by step. So thank you for your participation in that. Thanks again for listening to the Botanical Biohacking Podcast. I am your excited host, Dr. Andrew Miles.